Did you know that refugees and immigrants have been disproportionately affected during the COVID-19 pandemic? Let's explore why this is the case and what we can do about it as primary care providers. The COVID-19 pandemic has exacerbated inequities to health and socioeconomic status for refugees and newcomers. Many patients have struggled to access health care and social supports, and they continue to grapple with navigating a constrained healthcare system. My name is Dr. Rachel Talavlikar, and I work at the Mosaic Refugee Health Clinic in Calgary, Alberta. I am here today with my colleagues from the Canadian Refugee Health Network to provide knowledge and practical skills to increase your confidence when caring for newcomer and refugee populations. As background context, I'd like to review some definitions first. Refugees are individuals who've been forced to flee their country of origin owing to fear of persecution for reasons of race, religion, nationality, or social and political affiliation. Refugee claimants and asylum seekers are individuals who have made a claim for protection upon or after arrival in Canada, sometimes waiting years for their immigration and refugee board hearings. Undocumented migrants are those individuals who are not granted or are no longer granted permission to reside in Canada, whether they have entered the country regularly or irregularly.
Refugees, having faced forced migration with substandard living conditions and limited health care, are especially vulnerable. At the end of the first COVID wave, data from the Institute for Clinical Evaluative Sciences showed that, despite their test rates being significantly lower, refugees and newcomers had a much higher rate of cases than their proportion of the Ontario population. With the second wave, Toronto Public Health found 70 to 80% of their age-standardized COVID cases were from racialized individuals, and the Wellesley Institute found that such groups had illness, hospitalization, ICU admissions, and death rates 2 to 10 times age-standardized rates in Ontario. Later data showed their rates of COVID-19 vaccines were also less than that of other populations. A piece in the Canadian Medical Association Journal found that in major Canadian municipalities, cases were, quote, disproportionately concentrated in areas with lower income and education levels, along with a higher portion of visible minorities, recent immigrants, high-density housing, and essential workers. Layered on to pre-existing trauma and a multitude of post-migratory stressors, the coronavirus disease pandemic brought about further loss of access to settlement services, loss of employment and income, and prolonged social isolation, each of which exacerbated mental and social strain. Many refugee patients struggle to access their healthcare providers and familiar social supports, and continue to grapple with navigating a constrained health system. Obstacles included limited in-person visits and a transition to virtual care and online services, compounded by existing language barriers, inconsistent access to and familiarity with technology, and a range of social stressors. Overcoming such barriers required new and creative solutions, such as dynamic interdisciplinary teams, perhaps with more specialized or alternatively funded clinics, and case-by-case approaches. In this video, we will provide context and examples of challenges that newcomer patients face, and share potential innovations and solutions to help them overcome these. Specifically, we will discuss COVID-19 prevention, including the promotion of testing and vaccination, the impact of COVID-19 on women, children, and families, the potentials and possible limitations of virtual care.
Our understanding of COVID-19 has evolved throughout the pandemic. Keeping up with ever-shifting public health recommendations is a challenge for English or French-speaking patients born and raised in Canada with easy access to the internet. As you can imagine, keeping up with the latest recommendations is much harder for patients who are new to the country, may not speak English or French, may not have access to the internet, and other ways to keep informed about the ever-changing public health landscape. Primary care providers play a crucial role in informing patients about the latest public health guidelines related to COVID-19. you may be the only person that they can talk to about the importance of wearing masks, physical distancing, and hand hygiene. We recommend taking the time to explain the importance of this in culturally and linguistically appropriate ways. Further, primary care providers can provide supports regarding patients who are in mandatory self-isolation or quarantine by assisting their medical needs through virtual care. Don't forget to connect with your local settlement agency to help support patients with getting groceries and other simple needs. In our experience, newcomers are very motivated to do the right thing when it comes to following public health guidelines, so please take the time to answer their questions and keep your newcomer patients informed about the latest developments. Even when newcomers are fully aware of the latest recommendations, they often face many barriers in accessing testing, and primary care providers can play a key role. Often, they may not know where testing sites are. Registering for testing may require a patient to speak English or French. As well, online booking systems may not be accessible for patients without access to the internet. Transport is often a major obstacle, as patients should avoid public transit while under investigation for COVID. Therefore, connecting patients with resources for transportation like taxi chits or similar is very important. Finally, you are the key to vaccination. Unfortunately, newcomers are exposed to a lot of misinformation regarding vaccination for COVID-19. However, in our experience, they are quite open to discussing vaccination and trust the advice of their primary care providers. Please take the time to see if your newcomer patients have questions about the vaccine. Taking the time to answer their questions in culturally and linguistically appropriate ways can often change a vaccine-reluctant patient to a vaccine enthusiast. We've had a lot of success hosting multilingual webinars where patients can learn about COVID-19 vaccine. As well, multilingual fact sheets about questions related to the vaccines can be very helpful. Our colleagues have fact sheets in a myriad of languages, which we'd be happy to share with anyone who's interested. However, even after misinformation has been dispelled, accessing vaccinations, as with testing, can be a challenge. Once again, newcomers face a host of linguistic and social barriers in finding, booking, and getting to vaccine clinics. If possible, providing vaccine clinics at locations that patients know and trust can also help increase uptake among newcomer populations. We've seen great success with walk-in vaccine clinics hosted at trusted locations like primary care clinics and trusted community spaces.
Unfortunately, the pressures and challenges of COVID have continued to highlight and exacerbate the stresses faced by families and children. With newcomer parents often in frontline job roles, the luxury to stay home and teach when school went online, or being able to afford individual devices for all of their children to be online for school was out of reach. As a primary care provider, you are often in a position to identify and link patients to the agencies and programs that might be able to help families struggling with these concerns. Additionally, by offering support, you are likely to be the one the newcomer comes to, as they will trust you for issues concerning food insecurity, mental health concerns, or even for help if tensions are rising at home. Although newcomers often display immense resilience and capacity to problem solve and navigate, the additional barriers of language, access, and navigation skills through a system as complex as our education and healthcare systems can mean that they need you to help them find their way. Please reach out to resettlement agencies and be willing to connect patients in social and community programs to help address underlying social and economic stressors.
Virtual technologies have been successfully used to connect people while COVID-19 isolated them. From education to work to leisure activities, many of us feel zoomed out. Among physicians, some have found it difficult managing patient interactions and coping with the inability to shut off at the end of the day, while others have embraced their newfound flexibility. For refugees, such technologies have allowed some to remain at home to manage caregiving responsibilities, but others have found their privacy constrained with such visits, and many do not have affordable technology such as fast, reliable internet for multiple devices per family, nor have sufficient familiarity with digital tools or access to understandable instructions as to how to use such technology. As many families were obliged to quarantine on arrival, creative case-by-case approaches to COVID-19 care included use of virtual care with appropriate use of telephone or virtual medical interpreters when in-person care or interpretation was not feasible. With the pandemic, development of resources in multiple languages, able to be easily accessed using scanning QR codes with smartphones, provided quick information on vaccines, isolation, management of disease, COVID or otherwise, and resources for mental and physical health and social services. Yet more important was connecting people quickly back to in-person services such as health, education, social and community supports, given the barriers faced by many refugee adults and children with the virtual world.
Thank you for taking the time today to learn about the way that the COVID-19 pandemic has impacted newcomers to Canada, and what are some of the possible ways that you on the front lines might be able to help identify and then help patients overcome the barriers that they face. By supporting patients to access testing and vaccination in culturally and linguistically sensitive ways, helping them to navigate the complexities of shifting virtual health and education systems that require language and health literacy skills, and by providing them a safe, welcoming space to bring up mental health concerns, you will support newcomers to succeed during their first years in Canada. And although this can seem daunting, we are all here, and we want you to know that across Canada we have a network of clinicians and providers who want to help and support you in their work. It is with advocacy and partnership with our colleagues in the resettlement community that we can work together to overcome these challenges. Newcomers to Canada are our country's future. COVID has impacted them disproportionately, but you can be part of the solutions to ensure that despite these difficult times, they will be able to settle and make the best of the future that they can for themselves and their families in Canada.